Knee replacement has also been around for many years, 40 years, 50 years really. You say, well, what's knee replacement? A knee replacement, like a hip replacement, is treating the ends of the bones, right? The knee joint, like the hip joint, has got a white shiny cartilage at the end of the thigh bone, a white shiny cartilage on the top of the shin bone. And so what happens with osteoarthritis is those cartilage parts deteriorate and they become worn out. And so they wear out completely at some point till they're completely gone, till it's bone right on bone. So a knee replacement is a matter of replacing the worn out cartilage with a metal cap on the end of the thigh bone. Okay, this is a metal cap on the end of the thigh bone. This is the thigh bone. A metal cap on the top of the shin bone. This is the shin bone. And then in between these two pieces of metal is a piece of plastic. So the surgery is to change the shape of the ends of the bones to put these metal caps on. So the first thing we do is change the shape of the thigh bone, and then put a metal cap on the end of the thigh bone, change the shape of the top of the shin bone, put a metal cap on that, and then a piece of plastic in between. And that's a knee replacement. Again, how simple can it be, right? That's easy for anybody can do that. So this is the concept. This has been around for a long time. You say, well, how much better can you make that? I mean, that's, well, we can make it better by saying, look, people who come in for these joint replacements have all different shapes of legs, right? These machines, the mechanics of a joint replacement, this combination of metal and plastic works best when these parts are perfectly aligned, right? And so you take something that is not perfectly aligned and you want to change it to something that's perfectly aligned. So over the past 40 years, we've had instruments that we've used in the operating room to do this. The instruments look a lot like what you'd find in a carpentry shop. Protractors, dial gauges, calipers, right? And they work, right? Because we have to change this to something that's straight in line. So what's happened in the past decade is saying, okay, well, all these instruments are nice and they do the job, but how could they be better? So about 10 years ago, we started using computer-assisted surgery, right? Which, like a GPS in your car, we had an operating room computer system that would shine down, and anything that was within this range, we could see in 3 dimensions on the computer. So if we wanted to dial in a little bit of extra counterclockwise rotation, if we wanted to dial in 3 degrees, we could look at it on the screen and do it in real time on the computer to get the alignment as best we could. It increased the precision of the operation. Didn't necessarily change what we were doing, and that is getting the bones to get metal caps on the end, but it would improve the precision that we did the operation. And we know that the more precise the operation, the better the knee functions and the longer it lasts. So we did that for many years. Now we're into the next level of computer-assisted surgery, and that is to say, well, if we can realign, if we need to realign the bones, why not do it on a virtual image to start with, right? So this is what's called the custom fit knee replacement. The way it works is we get a CT scan. A CT scan is a 3-dimensional X-ray, right? And we get a CT scan of the whole leg from the hip to the ankle. And in particular, look at the knee. So we can see the knee in 3 dimensions on a computer screen. And if you can see something in 3 dimensions on a computer screen, you can operate it on the computer screen. So we do the whole operation on the computer. So we have a virtual model of the knee, of the patient's knee, from a CT scan, and all those measurements that we need, we can make on the computer. We can try things out. We can try different sizes. We can say this alignment is good or this alignment doesn't work, right? And once we're satisfied with the way the operation is done on a pretend knee, your pretend knee, then we can send that information to a company that makes instruments that fit exactly on your knee, not on anybody else's knee. And these instruments have built into them all the necessarily alignments, right? So this is what's called custom fit. The implants, the metal caps are the same, but the instruments that we use to put them on there are made from this You get to here. So this is it. So you see all these things that spin around? This is the way it works. That's the custom fit instrument. Goes onto the end of the thigh bone. The custom fit instrument goes onto the top of the shin bone. It's disposable, right? And then the implants that come in are the same. The metal cap on the end of the thigh bone, the metal cap on the top of the shin bone, and the piece of plastic in between. So the end result is the same, the knee replacement, but the custom fit instruments allow us to do the whole operation on the computer first. And so that way, when we're in the operating room, we're no longer scratching our head saying, well, you know, is this a size 4 or a size 3? Well, let's try the size 4, and if that doesn't work, we'll change it to a size 3, or, oh, we need to cut a little bit more here, or we need to change it. We've already done that. We've already done the big thinking while I'm at my desk having a cup of coffee, and you guys are at dinner, hopefully having a glass of wine. And so nobody's under anesthesia, and the surgeons have no stress because they're at their office, right? So we'll do the whole operation, all the big thinking on the computer, and then execute the plan in the operating room, which means the operating room is more efficient. If the operating room is more efficient, it means less anesthesia. Less anesthesia means less impact on the body, and it seems to be a faster recovery and a more precise operation. So that's what a custom fit knee replacement is.